A 72-year-old nurse practitioner went back to medical school, and that should make every healthcare leader uncomfortable. Not because of her age, because of what her story reveals. For years, we have described healthcare's biggest challenge as a workforce shortage. We need more doctors, more nurses, more healthcare professionals. But what if we are asking the wrong question? What if healthcare's biggest workforce problem is not finding more talent? What if it is losing the talent we already have? After 40 years caring for patients as a nurse practitioner, Dawn Zuidjeskraft decided she was not finished serving. At 72, she returned to medical school. Most people saw an inspiring story about determination. I saw a healthcare system exposing one of its biggest contradictions. We celebrate experienced clinicians when they achieve something extraordinary. But do we value them enough while they are still inside the system? Healthcare spends years creating experts. Then we create systems that prevent experts from doing expert work. Physicians and advanced practice clinicians enter medicine to diagnose, treat, and connect with patients. Instead, too much time is consumed by administrative tasks, documentation, insurance complexity, claim problems, operational friction. The problem is not that clinicians stopped caring. The problem is that healthcare has created too many barriers between clinicians and the work they love. The uncomfortable truth: healthcare does not only have a workforce shortage, it has a workforce utilization problem. A clinician with decades of experience carries something technology cannot replace: judgment, context, wisdom. They know when a patient says, "I'm fine," but something is wrong. They understand the fears behind a diagnosis. They recognize what cannot always be measured. Experience is not outdated. Experience is accumulated intelligence. The future of healthcare will not be built only by recruiting younger clinicians. It will be built by creating systems where experienced clinicians want to stay. That means reducing the friction that drives people away. It means protecting physician time. It means using technology to remove repetitive work, not replace human connection. The best healthcare innovation is not always adding something new. Sometimes it is removing what should never have been there. For physicians and clinic owners, the question is how much of your team's expertise is being wasted on problems that better systems could solve. Before adding more patients, more staff, or more technology, look at where time is leaking. Lost time, lost revenue, lost energy. These are often symptoms of the same problem: inefficient systems. Healthcare leaders need to challenge 3 assumptions. Older clinicians cannot adapt. They already have. They have survived decades of change. Training more people solves the shortage, not if the system continues pushing its professionals away. More technology automatically creates better healthcare, not unless technology gives clinicians back time to care. The story of a 72-year-old nurse practitioner returning to medical school is more than an inspirational moment. It is a reminder: healthcare's greatest resource may not be something we need to find. It may be something we need to stop wasting. The future of medicine will not come from replacing wisdom with innovation. It will come from combining experience, technology, and human connection. The healthcare systems that protect clinicians will be the ones that protect patients. A question for physicians, healthcare leaders, and clinic owners: are we truly facing a healthcare workforce shortage, or are we facing a healthcare system that has forgotten how to keep its best people? What would you change first? Share your thoughts in the comments. If this perspective resonates, share it with someone who believes healthcare can work better.